Hi everyone.
Hey.
Okay. Okay, so I hope we're coming up to the end of day 7. We'll see just how many notes we have. So that'll basically, depending on the number of notes, will depend on whether or not this is part 5 of 6 or part 5 of 5. You ready?
Yeah.
Okay, let's get going.
Before you get to that, let me ask you, and we'll show you Joint Exhibit 1022-0021. That's an operative note of March 10th, 2016. Can you see that?
Yes, if you could blow it up, it would be great.
Does that remind you of a procedure that Maya had at this time?
Mission date 310.
Let me ask it this way. Did Maya have a port installed?
She did.
Who installed it?
It was at Johns Hopkins.
And who was the surgeon there on the top under operative report?
Nevi E. Waltford.
And what was the preoperative diagnosis?
That was for...
Right underneath?
Oh, I'm sorry.
He's merely reading the medical record at this point, lack of foundation.
Sustained.
Is reflex sympathetic dystrophy, as you explained, the same thing as a diagnosis of CRPS?
CRPS, correct.
And from the best of your knowledge, going in and coming out of this port placement, was the diagnosis reflex sympathetic dystrophy, otherwise known as CRPS?
Same objection.
I think that one we're going to overrule. Different question.
Are they the same? Yes, they are the same.
And why was it necessary to have a port put in?
After all these procedures, every time she was going in, they're sticking her veins. That's tiny little girl, first of all, 9, 10 years old. After time, it was difficult to access the vein. This was the choice to go.
If you didn't believe that this was absolutely necessary for your daughter, would you have done it?
No, it was a benefit instead of, them trying and fail and try again.
Was it recommended to you, or did you just come up with it out of the blue?
No, it was recommended.
Do you remember which doctor recommended it?
No, it's most likely Dr. Hannah or Dr. Patrick. Most likely Hannah at that time.
Let me ask you something. Every one of these treatments the jury's hearing about, was there a prescription for them?
Yes.
Was it always under a licensed doctor's recommendation and prescription?
Yes.
So now she began the fusions with Dr. Hannah, and then did she try other treatments? Did she try a hyperbaric therapy?
Yes.
How'd that come about?
Beata did some research. I don't know, if it was within the CRPS literature or whatever, but
Was she on chat rooms with other
yes, she
therapies?
was. And that's, I believe, where Meg Bolin was involved as well. It's a group, but I could be wrong on that, where she found it. But originally we tried a hyperbaric chamber in Osprey, Florida. It was basically an inflatable hyperbaric chamber. I personally, from the fire service, didn't think it was beneficial. We used to take CO patients to a hyperbaric chamber, Luther General Hospital, and it was a big chamber, and that's what was in my mind all the time, was that's the place to go. When we went there, she's getting in, and it's like a jumpy house.
Sustained. That's your next question.
What, if anything, happened after you arrived?
I'm sorry, what?
Explain what the procedure was from your perspective.
It was the high saturation of oxygen, no drug therapy, which
Was that appealing to you?
that was extremely appealing.
Did you want your daughter to have to keep going on these infusion trips or these, or even trips up to Clearwater, if there was another remedy that could do the job?
We looked for the alternative, and unfortunately that was out of pocket, but that wasn't a consideration. We wanted to do something better for her, regardless of how much it costs.
Did it come about that you actually had to sell off some things to be able to afford some of these treatments?
We had a second home in Illinois, Elmhurst. We had a rental house, and basically we were going to have that money for a college fund. Unfortunately, we had to sell it to pay for her medical expenses.
Okay, and so now in May of 2016, this would be after about what, 4 or 5 months of the combination of treatments? And we haven't gotten to IVIG yet, but she tried IVIG as well?
She did, yes.
Okay. And so she went back to Tony Kreisman, her pulmonologist, to check on status of asthma.
Objection to the leading arm.
I'm trying to move it along, but okay.
And overrule the objection.
She did, and I believe he made a comment about.
All right, well, let's pull up 1024-0028. Okay. Now, let's turn to the second page, and that's got the listing of medications that have been prescribed over this period of time, with the exception of some from Dr. Wassenauer, her pediatrician, who was prescribing these things. Are these substantially the same medications that have been originally prescribed by Johns Hopkins?
The leading, Your Honor.
Sustained.
Are these substantially the same as the medications that Johns Hopkins had prescribed after that first admission?
Same objection, Your Honor, leading.
Overruled on that one.
Yes.
Okay, and so his concern was, I guess, cortisol levels were slightly low in that next paragraph. Underneath it says medications. Skip it. We can go to the third page then. Okay. Under physical examination, where was Maya examined?
In her wheelchair.
All right. And what was, and this was at Johns Hopkins? Was Dr. Kreisman a doctor at Johns Hopkins?
He is.
And this was it in his office?
I think this is the one I was present that I don't recall, but
All right.
I thought I'd seen it there somewhere. But yeah, it would have been in his office.
Okay. All right. And so how does he describe Maya now since her series of treatments?
She's a complete.
The medical record speaks for itself. Just
It's a
reading.
predicate to comment on it.
Sustained.
Did he find that Maya was a completely different child from when last examined?
Same objection, Your Honor. Let's wait.
Overruled on that one.
Yes, he does note that.
And did he find that she was not in any pain, she was not moaning, she was smiling, she was interactive, and she was very engaged?
Same
Yes.
objection and leading, Your Honor.
Sustained.
What were his findings, to the best of your knowledge, about that being a different child? What did he say, to the best of your
Same
knowledge?
objection, Your Honor.
Can I have the attorneys come forward, please?
Jesus.
Sorry. Gonna have the attorneys come forward, please. Jesus. Like, he.
They really don't want anything to go forward about their doctors in Johns Hopkins.
No. It's the treatment.
Yeah.
How it affected the family, because this is how the Kowalskis established damages.
Yeah.
But it just looks so desperate, and it's so painful, because it's like, anyway.
Visit. Did you notice that Maya acted as though she was not in any pain? Did you?
I don't recall that day, but according to reading this, she was in no pain.
Okay. Do you recall on that day whether she was moaning or not moaning?
I don't recall that, to be honest with you, but reading this, I would be more than satisfied to say that she did what she was doing well.
Well, how was Maya that day interacting with Dr. Kreisman at All Children's?
And she's happy. She's not guarding herself.
When she's not in any pain, does she exhibit those protective moves when anybody moves towards her that you
The
just
Alladina?
Yes.
No.
So from your perspective as a parent, her parent, if you see that reaction to someone trying to touch her, what does that indicate to you?
That she's in pain.
And her weight there is 25 kilograms. And was she still in a wheelchair at this?
Objection to the leading, Your Honor.
Sustained.
Did she walk in a wheelchair? Did she walk in or did she come in a wheelchair?
Physical examination, she was examined in her
It's just
wheelchair.
Objection, Your
Just
Honor.
if you recall, did you recall if you pushed her in or she walked in?
I pushed her in.
All right. And to the best of your knowledge, were there any significant rashes left?
Not that I'm aware of at this time.
Was Dr. Kreisman pleased by her recovery?
Calls for speculation. Objection.
Sustained.
Did Dr. Kreisman say anything to you to indicate that he was proud, amazed, or happy, some positive reaction about the progress Maya had made?
He appeared to be happy to see her condition the way she is in now at this time.
Your Honor, they're asking his recollections, just reading from the medical record at this point.
Okay, sir. What we want is what you remember. If you need to review the document, that's fine. Just tell us that you need to review the document.
Okay.
Okay, but let's not read the document.
My apologies.
So why don't you read that? It would refresh your recollection. Would you please read to yourself the second sentence of the first paragraph under physical examination?
Yeah, again, I object for the same reason in terms of him just reading the medical record at this point.
Now he's trying to refresh his recollection, so let's let Mr. Anderson, let the witness do that.
Go ahead.
She's doing well here.
All right. Well, the question is, having refreshed your recollection, did this refresh your recollection as to how your daughter was doing at this visit?
Yes.
And was she not moaning?
No.
Was she smiling?
Yes.
Was she interactive with Dr. Kreisman in terms of talking and laughing or saying things, responding? And was she engaged in the sense that she knew what the questions were and she was responding appropriately?
Objection to the leading, Your Honor.
Overruled on that one.
She's interacting with the doctor. And the other times, I'm sure she was the opposite. While being in pain, it'd be difficult where she would interact with the doctors.
So how many months was this after you got back from the Mexico infusions?
I'm sorry, I don't see the date on here. This is February, so this 2 months.
Okay.
give or
And
take.
so in this 2 months, can you tell the jury how much she had improved?
Objection, Your Honor. It's missing some evidence.
Overruled.
She was improving, doing very well.
And then if you go into recommendations, can you please tell us whether you independently remember what Dr. Kreisman says in terms of her medications, or would it refresh your recollection to read?
It's
The-
the same objection about reading the medical record.
Would you? I can do it.
Let's just, overrule the objection, but let's stop reading the records here.
if you'd read that to yourself, does that refresh your recollection about what the doctor told you as to the plan for the future?
Yes.
And did Dr. Kreisman object or say, or did he say anything about changing what she was doing with her infusions and other procedures? Or did he recommend continuing?
Nothing in reference to the infusions, just switching to Adavir.
Okay, but underneath that, does it, who does he say should be continuing the remainder of her medications?
Same objection, but reading records.
Let's approach, please.
This is really, really, really bad.
It is.
He just got told by the judge to not read, and he's just still reading.
Yeah.
And then the fucking attorney's like, underneath that, what does he say?
Yeah.
Like, he's not meant to be reading, you fucking moron. Stop it.
Yeah, no, he's annoying me a bit. He's annoying me a lot. He's reading more into that than Dr. Hughes did with in the Amber case. And she was literally just...
No. But Dr. Hughes was an expert witness.
Yeah.
He's not. The problem is that the attorney should...
Now let's continue on. How did Maya do the remaining part of that spring and summer?
She was doing fantastic. She was improving greatly.
How were her different symptoms doing?
Some of the symptoms were diminished. The strength, she had more strength. She was able to exercise more, pool therapy. And she was determined, and being less pain, it was easier for her to do more.
And how about her lesions? Did they go away, or did they diminish, or did they stay the same?
I do not believe there was any lesions at that time.
Her aldinia?
Aldinia, no.
No, it went away, or no?
I don't recall that being a problem at that time.
And then what about dystonia?
Dystonia, she had dystonia for quite some time. It may not have been as severe. The one picture in my mind that I think of is when she was doing that handstand where she's holding her body up, the feet, she had them pointed out, and it looked pretty good at that point.
Were you going to Dr. Hanna for infusions every day or periodically?
Periodically.
And were there groups that he recommended of ketamine infusions? Did he recommend it that you do it in groups, the ketamine infusion?
Usually they were in a group.
And so through the course then of the summer, how was Maya doing?
She was doing good. And she was also doing physical therapy there as well.
Now, can you tell us if Maya wanted to go back to school or whether she wanted to continue in her homebound program approaching the school year in 2016?
She wanted to remain at home because of the wheelchair and also doctor's appointments and her PT. If she went back to the school, that would interfere with some of the treatment and doctor's visits. So she wanted to stay home.
Okay. And was it your impression that this was a stressful event for her?
It was very stressful.
And what was the effect of that stress on her CRPS from your standpoint?
I don't understand it when things changed. Or...
Yes. Did anything change towards
Yes,
the end of the summer, beginning of fall?
Maya was asked by one of her school teachers to come to Taylor Ranch. The kids had a little lemonade stand, a fundraiser, and she wanted Maya to go to the school and see the children raising money for the Maya. So we went there and we went into the library, and the woman that runs the Homebound seen Maya there. And she figured since Maya could come to that fundraiser, she's able to come to school every day. So I believe that's what discontinued or interrupted her Homebound.
Was Maya in a situation yet, in your opinion, where she should go back to the school or to remain in Homebound?
To remain in Homebound, like I stated, we were doing physical therapy and everything else for her. And she wouldn't have got everything she needed at that time.
Got it. All right. So now, did her symptoms return at this point?
She relapsed.
And describe the relapse for the jury.
Just everything that we worked for and what we achieved just started going away again.
So, did you have an inkling that this might happen before it happened?
No.
Were you trying, you and Beata, attempting to assist her in staying in Homebound?
We were.
And did you ask Dr. Wassenauer to support you in that?
Yes, Dr. Wasner did a note to support it. And then we actually had to hire an attorney, Jane Windsor, to help us fight for that.
And what was Maya's concern with going back to Homebound? Was it going back to Taylor Ranch? Was it the wheelchair or what?
I don't think it's necessarily the wheelchair. It was more of, we were on track of seeing the finish line with Doc to get her better, and we wanted her better. And I honestly don't know what the main reason was, but it was physical therapy and doctor's visits and the treatments. If she went back, I think there would have been an interruption with her learning. So this was extremely beneficial, as you heard from Ms. Dieter. It was a good program.
And so, once these symptoms came back, did you have to strike that? Let's go with this. Now, I want to go through the Johns Hopkins doctors that you saw up until this point, and I want to ask you if you recall, when I name their name, whether they said anything negative to you up to this point about the ketamine treatments. So Leslie Carroll, MD, anything?
No,
Diana Young, MD.
no,
Rebecca Plant, MD.
no,
Nicole Armstrong Demores, MD.
no,
AJ Desai, DO.
no,
Annette Pargas, MD.
no,
Allison Burt, MD.
no,
Shayla Siraj, MD.
no,
Anthony Kreisman, MD.
no,
Amanda Groden, these are from the July 6th, 2015. Amanda Groden Cook, MD. Jamie Reed, MD.
no,
Jennifer Longo, MD.
no,
Amy Mason, MD.
no,
Ashley Collins, DO.
no,
Suzanne Jackman, MD.
no,
Joseph Casadante, MD.
no,
Sean Butler, MD.
no,
Magdalene Gondor, MD.
no,
Jennifer Castilli, MD.
no.
Seifu M. Demisi, MD.
Your Honor, I object lack of mistakes of record in terms of when these people signed.
Going to overrule the objection.
Now, that same group of doctors, if you could tell the jury, Johns Hopkins doctors, can you tell a jury whether any one of them raised with you, to the best of your knowledge, or raised about you or Beata, to the best of your knowledge, any concerns over medical child abuse or Munchausen by proxy?
Objection during what time period, Your Honor?
deal with the time period.
From the period I just went through of, it would be July 6th, 2015, up to October 7th, 2016.
No.
Was the first time that anyone accused you of medical child abuse or Munchausen by proxy on the October 7th visit?
October 7th.
Was that the first time that any doctor at Johns Hopkins had challenged the CRPS as the correct diagnosis?
To the relevance room.
Rural.
Yes,
This was the first time anyone?
that's the first time.
So now, on October 1st, 2016, there was a visit to Johns Hopkins ER, was there not?
Yes, that's correct.
And what was Maya's complaint?
That was for constipation.
And what is that, to the best of your knowledge, was the constipation, what was causing the constipation?
I was unaware of what caused it. Nobody really stated what caused it.
Did Dr. Hannah have an impression or diagnosis of why her bowels sometimes backed up?
There's I think I heard it the other day as well. Dr. Chopra may have mentioned it. It's anybody with CRPS, the muscles are not squeezed, the intestines not squeezed, and so everything backs up.
And so she had had this periodically since the diagnosis of CRPS, or had she?
Correct.
And so what happened on October 1st, 6 days before this period we're about to talk about? Any problems?
No, she was treated Marilex or something, and we went home.
Right. Gonna pause it there. I'm gonna get the number of doctors that he mentioned, because I don't have the number. Do you have the number?
No, it's
It
so
was-
many.
It was a lot. So I'm gonna do that whilst you make your points.
Yeah. First thing, Judge sustained objections about the Hopkins doctor that made, I forgot the word for it, the infusion thing for flies.
The pick line.
Yeah,
Yeah.
which I was like,
He sustained them as to lack of foundation, and it's like they had been talking about it for ages.
Yeah.
What are you on about?
yeah. Then they also showed us a long medical list of medical subscriptions and stuff that were that actually are licensed by licensed doctors. As well as a lot of medicines that was subscribed to Maya from Hopkins.
Yeah. This is muted, so
Yeah. And the Hopkins lawyers did object a lot when it came to their doctors and their treatments and the medicines and stuff. They really went on objection streaks there.
oh yeah, it's so it makes me wonder essentially what are they so scared about. But it to me it seems we've both said this, that it seems like because the hospital claimed in their opening statement that it cost them nothing,
Yeah.
ignoring the fact that Beata died, because apparently she means nothing.
Yeah.
I mean, clearly she did, because they didn't care what they were doing. But like the amount of stuff that they had to sacrifice,
Yeah.
they didn't have a normal life. I mean, the fact that they mentioned about the college funds having to be used for Maya's treatment.
Yeah.
Like, granted, it's a privilege that they're able to save that money, but it's designed to be used on a college fund. I would assume that if they have a college fund, they would have a emergency savings And it's just like how much did they have to sacrifice in their day-to-day lives
Yeah.
for just getting, treatment that was clearly benefiting Maya, which is so sad.
Yeah. Then we had the annoying part of Jack keep insisting on reading, which
we already spoke about that.
yeah, that annoyed the shit of it. But I was glad that he finally started to speak from his memory.
Well, they went on to something completely different,
Yeah.
I think, didn't they?
Yeah, but all of a sudden the mic turned low also on top of it. It was very low there for a while.
No, it was turned off.
Yeah.
I think it was turned off the entire time because it sounds different when he's coming through a different mic.
But yeah, no, what was I going to say? Oh yeah, that's also he also, like you said, all the doctors. How many now that was?
It was 19 or 20. Because
Yeah.
this is Jack Black here. I'm gonna say it's just as giving them one saving grace. It was 19 doctors that they saw.
Yeah, and no one of them said that ketamine was bad, but all of a sudden, Hopkins say, no, but ketamine is dangerous. It's
Well, they only brought it up at that point.
yeah. It was like,
But the question a side question though is why did she see 19 doctors?
yeah,
That's a bit
yeah,
concerning.
yeah,
I would assume that they would talk about it, but it's a little bit concerning for me.
yeah,
I would assume that it's because of her treatment, but then you would normally get a regular doctor to build
Yeah.
up a rapport, wouldn't you?
yeah. You should.
Anyway, okay, so this is the fact that they the judge sustained as to lack of foundation when they had been talking about this, but whatever, fine, okay, sure. Indications for procedure. So this is Johns Hopkins, right? Patient is a 10-year-old female with RSD, which is the older term for CRPS.
Ah,
Interesting. He was evaluated preoperatively in. Is there something down below? It's so difficult to read it. In something earlier this month for port placement due to frequent infusions. These infusions usually occur multiple times a week, and plus the patient was scheduled I can't read that word. For port placement, risks and benefits were discussed with the mother, and she agreed to proceed. Ultra-operative findings: normal autonomy, port placed in left lateral chest wall. procedure in detail. After proper informed consent was obtained, the patient was taken in the operating room and placed under general anesthesia. A preoperative timeout was performed by Dr. Walford. Antibiotics were administered. The left subclavicle vein was accessed with the guidance placed with the, is that guidance? I think, or guideline? No, with the guidance placed and noted to be in good position with ultra-operative. Oh my god. I don't know what that says. I can kind of see it, but it doesn't make sense. The end part of it looks like Scoopy. I don't know. A port pocket was then created in there, and then it cuts off.
Huh.
So that was right at the beginning.
Yeah.
The one that led to the objection, I think, because they realised, oh shit, we haven't prepped this witness. Or maybe, oh shit, she left because we're shit. Any other notes you have?
Yeah, it was, the last one was like, no one suspected Munchausen by proxy until
The emergency.
yeah.
So there's this one. So this is Johns Hopkins, I believe. This is the one that Jack was bloody reading. So annoying. Thank you for sending Maya back in to see me. Accompanied on this what? I can't read that. By her father. She remains under treatment for reflex sympathetic dystrophy. She is treated for this with a combination of ketamine infusions, one every 1 week for several doses. Is that? No, every 3 weeks. She is scheduled to receive this later today through an infusion center in Clearwater. In addition, she is scheduled to begin hyperbolic oxygen therapy through a center in Palm Harbor. She also receives monthly ultravenous hemoglobin. No. I'm just guessing the word here. I can't tell. The remainder of her medications include all of that, which is 22. Medications administered through the clinic include only the 2 things. I have no idea. She has been seen by... Zoom in? No, okay. Hold on. Oh, yeah. She is seen by an endocrinology with a concern that her cortisol level is still slightly low. She had a good stress response to Syntropane. The endocrinologist had requested dropping her Advar?
Not there.
Dosage if possible. According to her father, she had no significant asthma events in some time. The biggest change in her has been the improvement in her pain from synthetic dystrophy. Other diagnoses include intermittent to moderate persistent asthma, allergies to pet dander, and eczema. She still sees a large number of specialists who are detailed in her note of, I would assume, 10th of February. Or 2nd of October.
No.
Yeah, no, it's 10th of February. In my note of February, it was mentioned that she has not had acute intervention for respiratory complaints, with a variety of different medications given in serial order since at least November, possibly because of the influence of Advar 115. Physical exam. She was examined in her wheelchair. She is a completely different child from when last examined. By that I mean she is not in any pain. She is not moaning. She is smiling. She is interactive. She is very engaged. Oxygen saturation is 100% on room air. Weight is 25 kilograms. Height was measured as an arm span for the purposes of her lung function studies and recorded as 133 centimeters. As mentioned, she was examined seated in her wheelchair. Skin examined shows no significant rashes. There are no significant lymphadenopathy. HEENT was benign. Chest was clear to... Oh my god. Oscillation?
Oh, yeah.
Oh, it was clear. Heart exam was unremarkable. Abdomen was soft. Extremities show no clubbing. She moves spontaneously in her chair without incurring pain. Pulmonary functions were normal today. Impression 1. Reflex sympathetic dystrophy working diagnosis. 2. Mild persistent asthma may be present. Recommendations. Switch medication to a different medication. Continue medication. Continue the remainder of her medications under the supervision of their administering physicians. Follow up in about 2 months, at which time we need to determine whether there is indeed a significant enough asthma history to warrant any inhaled steroid prophylaxis? No. At the time, we may need to reconsider this for the winter months. Thank you for sending her. Regards. Ew. Shocking.
Yeah.
It's almost as if the treatment were fucking working. It's just like, if you could stop reading, keeps reading.
Oh, yeah.
Jesus, that was really bad.
Yeah, it was really, really bad.
Right. Anything to add?
I have a feeling, this is nothing to do with this, but I have a feeling that he's being, Beata reminded him on a lot of things, like you remind me to take medicine and shit. That Beata was doing that.
Yeah. Like she was just giving him recaps of what had happened.
Yeah.
But I mean, That's the thing, though, isn't it?
Mm.
Had they known what would happen if they took her to Hopkins that night, they wouldn't have taken her, I don't think.
No.
But if they'd known it would have come to this, like this was inevitable, Jack would have been more involved.
Oh yeah.
It would have had a negative effect on Kyle.
Yeah.
As well as, I would assume, on other aspects of their life as well. But he would be able to speak to more first-hand knowledge.
Yeah.
Right, should we get going?
Yeah.
I keep yawning. I don't know why. Sorry. Yeah, if you have any comments or anything that you would like to leave below, you can. Don't have to, but it's up to you. And you can leave a like or a dislike. We'd appreciate a subscribe if you could do that for us. It helps out the channel. And again, you don't have to. But hopefully we'll see you in the next one. If we don't, then enjoy whatever you do. Whatever you do. Doody. Anyway. Stay hydrated, wear sunscreen, and don't eat yellow snow.
And pet a cat and do not trust the seagulls.
True. Bye, guys.
Bye-bye.